Hey guys, it's Dr. A again. I appreciate all of you who responded to my Facebook request and let me know what you wanted to hear about. I think that the thing most people wanted to hear about was ADHD. But before I start talking about ADHD, I wanted to make a little piece to talk about how I think about mental health. Whenever we talk about mental health, people, they sort of freak out. For whatever reason, as a society, we want to deny that our brains can have issues too. So if you look at this little diagram, which hopefully I can show you since I am old and just figuring this out, you can see that the human body has many organs, one of which is the brain. Your brain is an organ like any other organ, despite the fact that we're weird about it in our society. What I tell parents is if your pancreas stops making insulin and you get diabetes, nobody tells you to wish your blood sugar better. However, if you get depression or you have ADHD or you have something because your brain isn't making the neurochemicals in the way it's supposed to, we're very judgmental and tend to tell people to try to fix it themselves. When you get type 2 diabetes, your doctor may tell you that you should diet and exercise, and then if that doesn't work, they will prescribe insulin. In the same way, if you get a mental illness like depression or anxiety, your physician may tell you to do behavioral therapy, and if behavioral therapy isn't successful, then the neurotransmitter that's missing needs to be replaced with medication. Medication, when it's used appropriately, which is something that we'll talk about in future videos, is highly effective. I always tell people that we should face the fact that we're all crazy. No one should be ashamed of seeking treatment if their brain is not functioning the way it's supposed to. I myself have taken medication for a lot of my adult life for depression, which runs in my family. We actually found letters from my 5th great-grandfather written in the 1840s talking about how he had darkness of mind and his second son dropped out of the University of Rochester for nervous prostration. So you can see the depression that runs in my family all the way back multiple generations. Fortunately, these days we have good treatment, and I've responded well to medication and cognitive behavioral therapy and doing great, something that wasn't available for my 5th great-grandfather. No matter what treatment you're seeking for a mental illness, behavioral therapy should always be part of it. I have a good friend that says that pills don't work without skills. Sometimes parents will come and ask for medication, and they aren't interested in pursuing the behavioral part of the treatment. However, in my experience and also from what we see in research, this is rarely successful, period. You can see I've been dictating for way too many years. There are many different kinds of therapy, and not every therapy is good for every condition. That's something that we'll talk about in future videos. The main point I want to make today is that A, your brain is an organ like any other organ. If it's not making neurotransmitters like it's supposed to, they need to be replaced, and no amount of wishful thinking is going to make that happen.